My name is Dr. Nicky. I'm the lead dietitian for intestinal failure here in Coventry. I've been working at University Hospital Coventry since 2004. My role as lead dietitian for intestinal failure involves looking after patients with complex gastrointestinal disease. So they're patients with intestinal failure, their guts are unable to absorb sufficient nutrients, and the vast majority of them are reliant on parenteral nutrition, which is nutrition via the intravenous route. So we have patients who require parenteral nutrition on the wards as inpatients. Some of those may be short term, some of them may be longer term, and then we have patients that actually go home on parenteral nutrition as well, and we support them with their sort of home management of this treatment as well. Dietitians became eligible to train as supplementary prescribers in 2016, and we had our first dietitian qualify in 2017. That was my colleague Dr. Alison Colkin, who's a trailblazer for us all. I qualified as a supplementary prescriber in 2018, and basically supplementary prescribing is a way for dietitians to prescribe, but it's within the sort of parameters of a clinical management plan, which is a partnership agreement between us, a doctor and a patient. So we have a defined scope of practice within our speciality field, and it just gives us parameters and support for those prescribing decisions and a route of escalation to sort of medical support as needed. However, dietitians feel very strongly that we should continue to develop as independent prescribers, and we're gathering the evidence to support that. In the last year there's been a campaign, Prescribing Now, which has been a multi-professional campaign to try and advocate independent prescribing rights for dietitians, and it's something the profession's really keen to move forward on. In terms of managing patients with intestinal failure, we have a daily ward round for our inpatients, so we go and see all of our patients who require parenteral nutrition wherever they may be. We have special wards which are designated for parenteral nutrition, where the staff are specially trained to deliver this treatment. So we'll go and see them on a daily basis, review for any changes, and amend their parenteral nutrition and any other associated medications as needed, and make those prescribing decisions as we're there. We also have outpatient clinics that we run, where we bring our home patients back to clinic for review of their sort of parenteral nutrition regimes at home. And we also we provide remote support for our home patients as well. So we're only at the end of a phone. They can phone us for advice and support any sort of working day of the week. And we also kind of monitor them in terms of their blood tests and things remotely as well. So we sort of have an ongoing sort of community management process for our patients. In terms of deciding to be a dietitian, it was a natural development for me. At school, science was my favourite subject. I did A-levels in biology and chemistry and psychology. I went on to do an undergraduate degree in physiology, but I wasn't quite there in terms of where I wanted to be career-wise yet. So I did some research over potential career paths which could utilise my interest in science but also allow me to work with people, and dietetics, when I came across it, ticked those boxes. I then applied to do a postgraduate dietetic degree, which I completed, and became a graduate dietitian here in Coventry in 2004. And I've been sort of supported to continue to develop within my various roles in this organisation. So I went on to complete my doctorate, which I was awarded in 2016. And then following that, when dietitians became eligible to train as prescribers, I undertook that qualification as well. So I achieved that in 2018. Since then, I've done some further postgraduate study to develop my research skills further. So I was awarded a postgraduate certificate in leading clinical research delivery last year. So we don't sit still. Continue to develop. I regularly recruit dietitians into our department, and one of the things I look for in applicants is enthusiasm and having passion for the role that they're applying for. Having those attributes really will see you a long way with working within healthcare. As dietitians, we develop lots of transferable skills as we develop within our careers. Often we focus on our clinical skills and development of speciality knowledge, but actually we develop lots of other skills working within healthcare. So we develop skills in leadership, and certainly the organisation here is very proactive in terms of developing leaders at all levels. So it could be skills through things like coaching or mentorship. It could be sort of understanding how to change processes and services through waste management and sort of continuous improvement. We certainly get lots of opportunities within dietetics to develop skills to support people as well. When I first started as a graduate dietitian, I had no skills to do with people management, but now sort of several years on, I manage a team of dietitians, so I've had additional training and built my skill set in terms of being able to support people through the appraisal process. I have skills now in how to recruit. Part of my role is leading on research projects, proposals and development of skill set within the department as well. Although we focus often on the clinical skills, there's a lot of wider skills that we develop as we progress as dietitians. If you're interested in becoming a prescribing dietitian, then you're interested in being a dietitian at the forefront. So focus initially on becoming a dietitian, then think about what your speciality interest is, because prescribing sits within speciality work. You don't become a graduate dietitian and start training as a prescriber straight away. You need to develop your skill set, develop some advanced knowledge and abilities, and then prescribing comes a little bit later. But actually working out where your interests are, what speciality you'd like to work in, that will really help get you there, and then prescribing becomes part of that role. I was always interested in intestinal failure from being a student. That was always the area that interested me. So from when I graduated, straight away I was asking about opportunities for shadowing and attachments to do with intestinal failure and parenteral nutrition. That then gave me the opportunity to develop into a specialist role working within that field, and then as the years have gone on, I've had more speciality training, built more experience, and gradually developed myself, and I now lead the team and have developed the team to expand within that area, with prescribing being part of that.